And I was just like living in that birth high. Like I'm feeling like emotional and so grateful thinking of that moment. It's like the most special moment. Just over 3 days ago, I had my third baby. And since his birth is so fresh in my mind, I wanted to take some time today and share his birth story with all of you. It was completely different than I had envisioned, and definitely would not have been what I would have chosen on paper. However, it ended up being just the most wonderful birth and super redemptive for me after having a 32-week premature baby in 2023, so just a little over 18 months ago. And I'm really grateful with how everything happened, and I just want to share the story with you as an encouragement for those getting ready to have a baby or those of you who just love birth stories. So let's jump into it. So since I had my second premature about 8 weeks early, spontaneously, I'll share that story another time. Let me know if you're interested. I was definitely on edge going into the third trimester with him. I didn't have a ton of explanation for my previous premature birth, but I did have a gut feeling that it was the outlier based on a variety of different factors. And so there's deep within me, I had a confidence that this baby would go all the way, maybe even until his due date, which, spoiler alert, he almost made it to his due date. Today is actually his due date. So at 32 weeks and 3 days, the exact gestation I had my daughter, I had one little scare where I thought I was going into early labor, just really consistent Braxton Hicks contractions that were getting more and more frequent over the course of an evening with some other symptoms paired. Ultimately, was about to go into the hospital, but rested and they went away. And I was really grateful. And I didn't have any more like scares like that until I got to 36, the very end of my 36th week, heading into 37 weeks, where things started to feel like they were happening. I was one day away from being 37 weeks and was feeling like I was having a lot of pre-labor signs. That whole next week I had a lot of pre-labor to the point where I had my mom come down for the week, and it ended up being a really good thing that I didn't have him that early because both of my kids came down with a really bad respiratory virus, and so they were sick all week and it was really stressful. It ended up being just a really stressful week, and I'm really glad that it didn't happen. But from that point on, I was basically in pre-labor, kind of early labor signs until I had him. So 37 weeks, tons of signs. Get to 38 weeks, still lots of signs. And then 39 weeks, I had just tons of early labor signs. Losing my mucus plug, spotting, cramping, contractions, prodromal labor, during the day, at night. Just a lot of stuff was happening, but it was never progressing into full labor. I had gotten checked a couple times, and at 37 weeks, I think I was about 2 centimeters dilated, 50% effaced. By 39 weeks, I was 30 centimeters dilated, 60% effaced, and just having a lot of contractions. So when I turned 39 weeks, I think the day after that, I decided, okay, like I'm ready to stop having prodromal labor. I want to kind of kick things into gear. So I took a bath that evening and just like really relaxed. Chris took our other 2 kids out of the house to give me some time just to relax for a bit. And I tried pumping for 10 minutes. I was going to try pumping for a little longer than that, but it actually caused really strong contractions really fast. And that freaked me out a little bit because it was pretty intense. And so I stopped at 10 minutes. But later that evening, I started noticing some like water, what I thought might be my water leaking, but I wasn't quite sure. It wasn't a lot, but it was concerning enough that I was, thinking about calling the doctor that night. It was too late and I had an appointment the next morning. So I just thought, okay, I'll just wait until my appointment. I'll go to my appointment and ask him to check me there. So that was Monday night that happened. Tuesday morning, I had my appointment and I asked him to check me. He was also going to do a membrane sweep. Just because of all the prodromal labor, I was more ready to get things moving than I had been with my first. Anyways, so I went to that appointment and I mentioned that I felt like I was leaking, just like having like tiny little gushes of leaking, and to the point where I was like having to change my underwear a lot and was feeling like this doesn't seem like it's normal. I've never experienced it in my previous pregnancies at this point. And so he ran a couple tests to check if it was my waters, and they both came back negative, which at the time I thought, okay, well, I guess it could just be discharge or something. But I also was a little bit like, I think this is just a really slow leak, and I think the tests were false negatives. But he did a membrane sweep and he checked me and said that's when he said I was 3 centimeters, 60% effaced. So I went home from that appointment thinking, okay, well, maybe I'll just go into active labor in the next couple days. Nothing really happened that day. I didn't really have any crazy symptoms. I was still having some prodromal labor, contractions every like 8 to 10 minutes, maybe. Nothing strong, nothing that was gonna send me into the hospital. But I went home and we went on a walk. We did a bunch of stuff that day. And then the next morning, Wednesday, I decided to go to the beach with my kids and my mom. We went to a playground on the beach and we're walking around, and I was just feeling like the leaking was just becoming more and more frequent, and it just felt like, at this point I was having to wear pads or like a diaper, because it was just so much, and I just didn't feel like that was normal. Often, if I would lean forward or move certain positions, I would leak, and I called the doctor's office, and they basically said, okay, you should go into labor and delivery to get it checked out again. So we were at the park and we went home. I picked up Chris and I said, okay, we're gonna go to the hospital. We already had everything all ready to go because the previous day I thought that they might send me to the hospital after my appointment. So everything was all ready. We had already kind of trial packed the car. I told myself they're probably just gonna send me home. We'll be back in a couple hours. So we said bye to the kids, packed up the car. My mom was there to watch them, which was huge. And we went to the hospital to get checked out. I remember when we left the driveway, I was thinking, we're going to be back in a couple hours, but if we're not, then the next time we'll be back here will be with our new baby. So we get to the hospital. They get me into a labor and delivery room right away, which is really nice. It wasn't just a triage room. They set me up with a nurse and everything. It was a really smooth process. They got me right into a room. It was a really nice room. We had toured the hospital, and when we toured, the room was tiny. And so the room that we were in was way bigger, and it felt like a more comfortable space for if in the chances where I was going to go into labor, that I could be comfortable there. I was feeling like two really conflicting emotions. One, I hope it's my water, because then that means they'll keep me and I'll be able to have this baby, and I'm so excited to meet him and so tired of prodromal labor and everything. But the other side was, I hope it's not my water, because then I'm going to have to get induced, because my contractions had not picked up and I was not in active labor, and I knew it had been leaking for potentially up to 2 days at this point, and there's a risk of infection, and I had done all the research and I didn't want to risk going 3 or 4 days past my water leaking and just living with the anxiety of potential infection, and is the baby okay, and does he have enough fluid, and all of those things. So I was feeling really conflicted, and I really didn't know what to do with that. So I was just praying that I was praying that they would get the right answer, so that if it was leaking, that they would get the positive result. I was really afraid that they would get another false negative and that I would be sent home and that something bad would happen or negative would happen because of this. And so I was really just praying, like, God, please just give the nurses and doctors the wisdom and the results they need to make the right decision. And I had planned a hospital birth since I had a previous NICU baby and a premature baby. I didn't want to like risk planning a birth center birth or a home center birth and getting transferred to a hospital and having to pay both fees and bills. So I just planned a hospital birth anyways and was hoping to do it as like unmedicated and intervention free as possible. Because my first 2 births were really low intervention, unmedicated births, even though my daughter was premature. And I really loved that experience, and I loved the birth high and just the feeling of empowerment that I got from having unmedicated births and just seeing my body do that. And I just was really, really excited about it this time around. I was not afraid of birth at all. I was so excited about having another unmedicated birth. But I had heard so many stories about inductions and how intense and painful the contractions can be and how long it can take. And so I was really afraid that I couldn't do that unmedicated, or that I wouldn't want to do that unmedicated, and that I would be faced with just like really different choices this time around. And so there was a lot of unknown. So anyways, they checked me. My dilation and effacement was the same. And they did the same 2 tests. So the tests that they ran to check if it was my waters were a pH strip test. They collect fluid from your cervix and they test it with a pH strip, and amniotic fluid, it has a higher pH than other fluids. And so if it comes up positive, then it may likely be your amniotic fluid. However, there are other things that can make a test positive. So this is kind of like their first test. And they also do a test called a Fern test, which is when they take a look at the fluid under the microscope, and if it crystallizes, that means that it's amniotic fluid. And so they collected the fluid and she ran the pH test and it came back positive. And I was like, what? Because the day before they had done that same test and it did not come back positive. But they had collected fluid a different way the day before, and it felt like this time it was more, the way they had done it felt like it would be more accurate. So then they had collected the fluid for the Fern test, and the nurse said basically, there's not really any fluid in your cervix. There's no pooling. So she basically thought it wasn't my waters. And then while we were waiting for the results of the second test, because they have to send it off to the lab, the doctor came in to do an ultrasound to check the baby's fluid levels, just in case my water was leaking. She wanted to be sure that the baby still had enough amniotic fluid. And so when she did that ultrasound, she said basically my fluid levels were normal, which if your water had completely ruptured, your fluid levels would be very low or non-existent. So that meant that he still had plenty of fluid around him, and also that maybe it wasn't my water leaking. So I'm just sitting there like so confused. I'm trying to research the pH test on my phone to like see how often like false negatives happen or false positives, and like what can it mean. And just I'm a researcher by trade, I guess, by background. And so I was wanting to have all the information myself because I had great providers, but I know like they're not always perfect, and knowing the data and the information yourself can be really important for advocating for yourself as a patient and advocating for your baby. So we waited there for a while, and I was praying, we were listening to worship music, and we were just kind of talking, and like I think we both thought this next test would come back negative, and then I didn't know what they would do at that point. And so when they came in and she said it was positive for your waters, she was like, and we're having a baby today. And I was like, just this like huge like flow of emotions. Like I said, I was constantly toggling between, I can't wait to meet him, I'm so excited for this baby and for this birth, to this is not how I wanted things to go. I wanted my body to go into labor on its own, and I know that they're going to have to put me on Pitocin, which I was really afraid of. And also because my waters had been leaking for 2 days, it meant they were gonna have to do extra testing and monitoring. I would have to be on the heart rate monitor constantly, which I really didn't want. And there was just a number of different things that like were overwhelming for me. I'd have to have an IV for the Pitocin. There's all these things that I was just like, ugh, I don't want this. This is not what I had planned. But I've researched this. I know this is what needs to happen. And I was frustrated with the whole situation. I also was frustrated, like partially at myself, because I think pumping ultimately is what caused the leak. So I was just feeling a lot of emotions. I wasn't having like strong contractions. I had a couple here and there. And my like main hope was that this birth would be peaceful and joyful no matter what, because birth is not in your control and you can't plan it or predict how it's going to go. But I trusted that God would provide peace and joy in the birth experience, even with things being uncontrollable to some degree. So after they basically confirmed it was my waters, like, we're going to admit you. I think it was like around like 3:30, 4 o'clock in the afternoon at this point. And I was like, Chris and I were both getting really excited, but also like those conflicting emotions were coming up. And I was asking a lot of questions about like, well, like once you put the Pitocin on, like, can we turn it off if it kicks labor into gear? And I was just asking a bunch of different questions, and they were kind of like, it's not really what we would do. And I just wanted to make sure that I felt like my choices would be respected and understood, even though this wasn't my original plan. So they started me on Pitocin probably like an hour or so after they admitted me, after they tracked my contractions. And I told them basically, I know my body isn't going into active labor right now. I know I'm going to need something to kick it into gear. I was contemplating pumping, but with my experience with it causing the intensity of contractions, I didn't want to do anything that would potentially be too much for him. And so I honestly felt a little more comfortable with Pitocin than I did with pumping. And the other thing about Pitocin is I had been on like a level 1 Pitocin with my daughter just for like 30 minutes before she was born. And so I knew that I had responded really well to it in that instance, like to the point where it took me from 6 centimeters to 10 centimeters and my water broke within like 30 minutes of getting it. And I had her, just a few minutes later. So I thought, okay, I think they're going to be able to do Pitocin on a really low dose and it will kick things into gear really fast. This is my 3rd baby. I've had really uncomplicated births, quick labors. And so they started me on a level 1. And after like 30 minutes, I think of an hour, it wasn't really doing much. And I knew it wasn't doing much. And I was feeling discouraged. I was like, how high are they going to have this go? I'm starting to get worried about how long are they going to let me go before trying to push a C-section. And they didn't talk about C-section at any point. So that was really reassuring. I was having a lot of anxiety because he was being monitored 24/7. And so I could hear that heart rate monitor, and it brought me back to my daughter and my hospital stay with her when I was in preterm labor. So there was just a lot of things going on in that time where we were waiting for my labor to kind of kick into gear. So from I think 4:30 to 6, not much was happening. They turned it up to a level 2 Pitocin, and that's when my contractions started. Actually, they started becoming really regular pretty fast. And so by I think 6:30, I was feeling regular contractions that were strong but not super painful. I was I think laying down with the peanut ball, where they put like this ball between your legs and it's supposed to open your pelvis. And I was trying to just get some rest before things got crazy, and they did get crazy very fast. But the contractions, like once they kicked into gear, were every 2 to 3 minutes, like right off the bat, lasting a minute long. I was timing them on my phone because they were looking at them on the monitors, but sometimes those monitors are not super accurate. So I wanted to know how frequently these were happening. So I was looking at my phone, and it was really encouraging to see them happening every 2 to 3 minutes. And then by 7 o'clock, I would say I was in like active labor. It was getting pretty strong. The contractions were strong. They weren't super painful yet, but they were every 2 to 3 minutes, lasting a minute long. And I was at the point where I was like, okay, I need to get out of this bed. I need to move around. I had an IV, I had the monitors, but they were wireless monitors, which was great. So I could move around. I was using the bathroom a lot. Like I was peeing a lot because I had learned that the more you empty your bladder, the more room baby has to go down and drop into your pelvis. So anytime I had to pee, I was using the bathroom. And then I lived on the yoga ball a lot. So my first position I got into was on the hospital bed. Actually, I had the yoga ball on the bed and I was on my hands and knees, or I was on my knees and then my arms were draped over the yoga ball. And I just kind of like rocked for maybe 30 minutes or an hour. It was until my knees hurt from being in that position for so long that I needed to move. So after that, I got up and then I sat on the yoga ball and did hip circles. At this point, it was probably getting closer to like 8:30 and things were getting more intense. I hadn't been checked since initially getting there, and I told myself, I'm going to ask them to check me at 10 o'clock just to know where I'm at, what my progress is, because I was feeling like really tired and I just wanted to know where things were at. So for the next, I don't know, hour or so, I just did hip circles on the yoga ball and we were listening to worship music. We were singing worship music, and my husband Chris was doing counter pressure. He started doing it pretty regularly once I was on the yoga ball because he could tell the contractions were getting intense just based on how I was breathing and how I was acting during them. I was having to work through them a lot more. I had a comb, a labor comb that I was using for every contraction. I would just dig it into my hand. And between that, the counter pressure, and the yoga ball, those are like my three coping methods that I use the most as in terms of like physical things that I used. But the breathing was actually the most helpful thing that I did this time around, where I just pressed simple breathing in for 4 seconds and out slowly for 7. And what I found is that I basically had to do that 3 times for each contraction to get through them. And so I focused, instead of on the whole contraction, I focused on one more breath and like, okay, I only have to do one more breath. And then, so each time a contraction came, I just started breathing. And as they got intense, I was like, one more breath. And that really helped me break things down moment by moment instead of thinking about how dilated am I and how long is this going to take and how intense is it going to get. And so we got closer to 10 o'clock and I felt like I was starting to go into transition, but had no way of knowing if I was actually going through transition. But I was starting to have labor shakes where my body was shaking. I started to feel nauseous and requested like some emesis bags in case I had to throw up. I was really exhausted, so I was kind of falling asleep while between contractions while sitting on the yoga ball, and I was worried I was going to fall over. So at this point I said, okay, I want to get checked, and then I wanted to lay down after that point, or I was getting close to the point where I wanted to lay down. So I got in the bed, they checked me, and they said I was 6 centimeters and 80% effaced and a -2 station. So I had made a lot of progress, but I wasn't like right about to give birth, or at least so I thought. And so that was at 10 o'clock. And then from 10, I said, okay, I'm going to give myself one more hour. At this point, I was really contemplating medication or an epidural just because of the induction part of things and feeling like overwhelmed. And I think having a hard time trusting my body with being on Pitocin and like everything. So I thought I was in transition, but I was also just not sure, and I didn't know how long I wanted things to go on. So I just told myself, okay, one more hour. We'll take one more hour. And this was all internally that I was making these decisions. I wasn't like letting anybody else in on this. So for over that next hour, it was intense. I was like having the shakes. I was nauseous. I was feeling like I was in full transition. And so I wanted to get checked again at 11 because again, I just wanted to know like are things moving quickly like they feel like they are. So I said I'm going to give myself to 11 and I'll get checked. And then at 11 I decided, okay, I need to get in the bed. I'm so tired. I'm so exhausted. I just need to like be able to close my eyes between contractions. And so at 11, she checked me and she said I was 8 centimeters, the same effacement. I don't remember if he was at the same station or not, but it was happening. Like things were moving quickly. And I said, okay, I can do another hour. But I was in labor land. Like it was intense. Everything was very strong. The contractions were really strong. And right after she checked me, it was like minutes later. So it's 11 o'clock when she checks me. I'm in the bed. They put the peanut ball in between my legs. I started to feel like I was starting to push. And I remembered like those early pushing urges are small. Like it doesn't feel like all consuming. It's kind of like, oh, I feel like I'm starting to push. And so I said, I feel like I'm starting to push. And she checks me literally minutes later. She had just checked me. I was 9 centimeters. And minutes after that, I was full on pushing. Like my body was uncontrollably pushing to the point where it was taking over everything. And I knew this baby was coming out like fast. He was not waiting. So she gets the midwife to come in because I'm pushing and it's like all consuming. Like my body is doing its thing. I'm on my side with the peanut ball and I'm just like fully surrendered to pushing. It felt like the most intense experience. Really strong ring of fire already. So I knew like he's about to crown, like he is coming out. And so she brings the midwife in who I hadn't met before. And she was awesome. This midwife was really great. And the nurse I had was really great too. She was like, well, the peanut ball did the trick. And I think that it really did help getting in that position to open my pelvis at the very end. Just made things go like really fast. And he just descended fully from a -2 station to that +3 station really quick. So the midwife came in and she could tell I was pushing. And I asked her like, am I complete? Like, cause I was a little nervous. Like, I don't want to have these horrible tears because I'm pushing too early. And she's like, just trust your body. Like it knows what it's doing. And that was like exactly what I needed to hear and what I needed from a provider, because that's how I wanted my philosophy to be. But I hadn't experienced that from a medical provider before to that degree in one of my births. I had a lot of fear around pushing because my first baby was born, really beautiful birth. I have a birth vlog for him actually. But I did push for 3 hours with him. It took a really, really long time. It was unmedicated. You know, I was doing things as physiological as possible. There was no intervention. I had a great midwife. I had a great team. But it's still like the pushing phase was really hard and really long. And so I had a lot of anxiety. So I'm thinking, well, I'm about to have a baby, like my biggest baby yet. I knew he was going to be bigger than my first. I knew he was going to be bigger than my second. I'm thinking, is the pushing is going to be like 3 hours again? Is it going to be really hard for my body? Am I going to be able to do this? Like all of these questions kind of in the back of my head, these doubts. When it came time to push, I'm feeling like he's coming right now. And in the back of my mind, I'm like, is this going to take 3 hours? Because I cannot handle 3 hours of this intensity. But at that point, like there was no medication, there was no epidural. Like the only way out was through. I was not going to be relieved of this intensity until I gave birth to this baby. So I just like pushed and just like let my body lead, but kind of just like worked with it. And at first, I think I pushed maybe 3 or 4 times. It wasn't much. But it basically was one nonstop contraction that he came out in. I didn't really get breaks between, where with my son, I would have like really long breaks between pushing. It was basically like once I started pushing, it was just I was pushing and there were no breaks. And so at first I was like kind of tense and I was overwhelmed by the magnitude of the pressure and the intensity and the ring of fire. And then on his last push, or maybe the last 2 pushes, I realized, okay, I can breathe him out. I'm going to breathe just like I was breathing during my contractions. I took 1 deep breath in and then I just breathed slowly out. And I just kind of surrendered to the intensity of the experience. I knew it was going to be I knew it was painful. There was no way out but through. And I felt him come out, and it was just like the most, that feeling when their head comes out is just the best feeling in the world. The relief and like you did it. You just birthed your baby, and of course their body has to come out too, but the body is really easy once the head's out. So I got the head out, and then I just took a deep breath and like let that relief and that wave of immense gratitude for what my body had just done like wash over me. And then I just pushed his body out, and I was just like living in that birth high. Like I'm feeling like emotional and so grateful thinking of that moment. It's like the most special moment. The most special moments of my life are when I push my babies out. And it's not just, it's more than just meeting your baby, which is huge in and of itself. It's that like feeling of what your body just did and what your body just brought into this world. And that's why I like unmedicated birth so much, is because I don't know what it would be like with an epidural or with medication, but the feeling of doing it the way I've done it is so overwhelmingly wonderful. I just don't want to do anything that would risk that. And there's a lot of other reasons too, that I like to choose unmedicated birth. There's a number of reasons, but that feeling is the number one reason. So he came out, and the other thing I had really prayed over this birth was redemption and having a birth that was redemptive. With my daughter, she was a 32-weeker. I knew they were going to take her to the NICU pretty much right away. And she was there for 19 days, which was very short considering she was 32 weeks. But it was 19 days of being away from your baby and not getting that bonding time. Also, the breastfeeding journey was completely set off track and never really happened with her because of that. So this baby, I wanted it to be redemptive. I wanted that moment, that hour, the golden hour. I just wanted him on me, and I didn't want anyone to take him away from me for any reason. I just wanted my baby to be with me and to experience the beauty of that bonding. And so when he came out, Chris actually caught him, which was really cool. He kind of advocated for that for himself, which I think was amazing. I told him he could do that. Like he could ask the provider if he could do that, but I honestly forgot about it. So the fact that he kept bringing it up with providers, I was like, oh, he really wants this. And so I'm really glad he was able to do that. So he caught the baby and kind of brought the baby through my leg to me because I was still on my side and with a peanut ball, I think. I think the peanut ball was still literally between my knees. And so he caught the baby and put the baby up to my chest. It was just so special. Just having him there and just knowing like what we had just done. And I think the birth high was actually even higher. One, because this is my third baby, and the last two, there was just different things that kind of kept me from being able to like embrace the fullness of that experience. But also because I had been kind of induced and had been on Pitocin, and it wasn't the complete physiological way I had wanted things to go, I felt like even more empowered. Like I just did that even with all of these barriers, and that made me feel like a superhero. It just made me feel really proud of myself, and also it quieted a lot of doubts and a lot of fears, and I was just really grateful for the whole experience. So the other thing I really loved is I had wanted to push on my side this time because I had heard that can decrease your risk of tearing. I had torn with both of my previous births, so I kind of expected to tear, but I wanted to do whatever I could pushing wise to see if they could help. And I didn't want to push on my back with my legs up in stirrups. I had actually ended up doing that with my second, and I think even with my first at the end, just because that was the only thing I found comfortable. And so with this baby, I was on my side. I wasn't in stirrups. There were no bright lights. There wasn't even a doctor in the room. It was the midwife, a nurse, I think a baby nurse, maybe someone else. It was really quiet. It was really peaceful. We had worship music playing. There were little tea lights, like LED lights around the room. It was dark. It was almost midnight. And it was just the most peaceful way he could have come into the world given the circumstances. And then he was just on my chest, and they left him there for, I don't know, I think he was on my chest for like 2 hours. It was great. They didn't ask if we wanted to get his weight or his length. They did any like assessments of him on my chest. They didn't take him away for anything. And then they did have to stitch me up because I tore, just like I did with my other two. It was a second-degree tear. But the good news this time is she said it was a really uncomplicated tear, very straightforward. Whereas with my first, it was a very complicated second-degree tear, so the stitching was more intense. And then with my second, it was a simple tear. I think it was second degree as well, but it was another simple tear. So I was just feeling like, okay, I can handle a simple second degree tear. I've recovered really well from them in the past. I knew what to expect. I knew there would be stitching. But the stitching with my first was actually really traumatic because of how long it took and how uncomfortable it was. And so I was really, really grateful that it was uncomplicated and would likely be quick. And it was. It was maybe 15 minutes. It wasn't that bad. They gave me the lidocaine shots so that I would be numb because I didn't have medication or an epidural, so you feel it a lot more. But it was quick. I delivered the placenta really easily. I wasn't having any excessive bleeding at all. I was just feeling like this is actually my best birth experience. Even though it started off totally different than I wanted. I feel like this is everything I could have asked for and more. Like, I felt so overwhelmed with gratitude for, I guess, God's provision over his birth and just the experience that I had had. And it was peaceful and it was joyful and it was redemptive. And it was all those things I had prayed for so many months. And that's what I said to everyone. I said, you know, I would love to do an unmedicated birth. I would love to have a vaginal birth. But what I really want is I want it to be peaceful. I want it to be joyful. And I want it to be redemptive. And this baby, he was not planned, but from the beginning, he was like just such a gift. And my husband and I went through a really hard season while I was pregnant with my daughter and slightly before that. So that whole pregnancy was marked by a lot of pain and a lot of trauma. And then this baby, it was so different. My pregnancy wasn't painful or traumatic. There was so much healing and so much joy and so much anticipation for him, even though we weren't ready, quote unquote, to have our third baby yet. As soon as we found out about him, we were so excited. So after that, there wasn't a whole lot that had to be done. We were in the labor and recovery room for a couple of hours. We kind of just like sat in that birth high with this little baby. As soon as they were done stitching me up and I could like get moved around a little bit, I latched him on and let him nurse. And then I kind of just like let him nurse on and off for those first 2 hours. He was pretty much just like on my boob most of the time, nursing and latching. And that was really redemptive because I didn't get that with my second. With my first, our nursing journey basically ended for the most part at like 3 weeks postpartum. We tried for many, many months, but there were so many barriers. And ultimately, the redemptive part of my journey with this baby was I'm really hoping to have a better breastfeeding experience. So, and I'll share more about that as it unfolds. We're only on day 4 here. So far, it's going really well. But I have a lot of anxiety and a lot of fears there. So definitely praying over that right now. And so far, postpartum has been very, as good as it could be. I think I'm feeling like some of the baby blues, just like feeling just like sad in general, but also really happy, and just the emotions are more intense right now. So that's his birth story. And like I said, it was very different than I would have planned or predicted. I think what I wanted was to go into labor on my own, get to the hospital, be 6 or 7 centimeters dilated, push a baby out quickly, have a wonderful golden hour. That's what I would have liked. Similar to what I got, honestly. I think honestly what happened was very close to what I had wanted. And even though like some of the variables were a little different. So ultimately I'm really grateful. And like I said, I honestly think I'm grateful for how things went and wouldn't want them to go any differently because it forced me to surrender. It forced me to trust. And it forced me to, I think, see how good God is even when things don't go the way we want them to, how present he is and how good he is. And I couldn't ask for anything more. So leave your questions in the comments. I'll be happy to answer any. And if you're getting ready to have a baby, or you're watching this because you are preparing for your birth, I hope that you have a beautiful birth, and that you feel and that you have a birth that is peaceful and joyful, and everything that you are hoping for as you meet your baby. Thanks, guys. We'll talk to you soon. Bye.